We all know the cliches. Beauty is in the eye of the beholder, and true beauty emanates from the soul. It's not in outward appearances. But how beautiful we look often depends on how beautiful we feel. And if we aren't feeling the beauty in us, well, today in the 21st century, if there are practical options to improve that situation, heck, why not? If we're confident we look beautiful, our general self-esteem increases exponentially. Tonight, we have the second of our two-part special on Shinagawa Lasik and Aesthetics Center. Last week, we talked about LASIK with Dr. Jimboy Binglasan. Tonight, we feature the aesthetic side of the renowned Shinagawa, which is reputedly Japan's #1 cosmetic surgery chain. Heard on Thursdays tonight, we have Dr. Ely Tan, Medical Director of Shinagawa Lasik and Aesthetics Center, located at the Enterprise Center in Makati. Good evening, Dr. Ely.
Good evening, Rafael, and good evening to all the the listeners of Monster Radio RX 93.1.
Welcome. So now we're looking at the other side of Shinagawa. Last week we talked about LASIK. Now we talk about the aesthetic side. You selected such a nice name, aesthetic. It's all about beauty and art. It's not something. Kasi pag sinabi mong cosmetic surgery, it's still a little terrifying to some people. What do you think, though?
Yeah, when you say aesthetics, it's like a classy term for beautification.
Right. And you can beautify anyone these days.
Yeah, I agree.
It's something that's, an opportunity that's afforded to us in this day and age. And, well, some of us choose to take advantage of it. There's nothing wrong with that. Is there still, like a bias in your perception, Dr. Ely, when you talk to your patients, is there some bias or fear when it comes to undertaking cosmetic surgery or procedures?
Now in the last 10 years, the practice of aesthetic medicine or cosmetic surgery has
I like
evolved.
that, aesthetic medicine.
Yeah, thank you. Before, patients usually go under the knife. Now, there's a paradigm shift from surgical to a non-surgical procedures.
There are more non-surgical procedures
available
these days.
There are more options right now.
And a lot of these procedures evolved or at least became popular in Japan first, right?
Yeah, most of the procedures that we are offering right now are evolved from our branch in Japan.
Well, Shinagawa is the #1 cosmetic surgery chain in Japan. What does this mean in terms of the quality of service of the products that you bring, the quality of services and products that you bring to the Philippines?
In Japan, Shinagawa has been in the practice for almost 26 years, and with over 3 million successful procedures. This means that Shinagawa is providing each patient here in the Philippines or in Japan with the highest quality and time-tested procedures.
What is it about Japanese and aesthetic medicine? Bakit ang hilig nila doon?
Maybe because of the acceptance of the society towards aesthetic surgery or aesthetic medicine. In Japan, when I was there undergoing training, we can see in the billboards left and right cosmetic surgery advertisement, and also in the TV.
So there's no prejudice, or there's little prejudice against aesthetic medicine in Japan.
Yeah, and unlike here in the Philippines, there's a restriction regarding that.
We're very conservative in a lot of things, including tinkering with our God-given features.
I suppose. We are a little bit conservative with regards to that sense.
Mm-hmm. But in Japan, what are the common procedures? What are procedures in Japan that they take for granted that here we still are skeptical about or have a lot of questions about?
When I was in training in Japan, most of the surgical procedure we saw was more on the double eyelid surgery.
Oh, double eyelid surgery? What is that though? Tinanggal na yata yung eyelids ng double eye surgery.
As we can see, our Asian neighbors have one. The upper eyelid is not prominent. So Japanese has became obsessed with double eyelid surgery. So mainly the bulk of surgical procedure in Japan are double
Double eyelid
surgery.
surgery. So the net effect of double eyelid surgery is
Is
that
to create a fold.
I see. So less Asian yung
Yeah,
looks mo when it comes
it's
to
more
the
of a
eyes.
Caucasian eye.
I see. Um, here in the Philippines, are people interested in double eyelid surgery? Do you have that as well?
Not so much with unlike here in Filipinos.
Meron
You-
naman tayo eh.
yeah. Mostly the surgical procedure are nose slip.
Yun ang popular dito.
Yeah, nose slip ang popular sa
The
Philippines.
nose slip. So that's what is Asian about us that we want to, I was about to say mess around with, that we want to enhance.
Yeah, the Asian nose.
The Asian nose. So if in Japan, in other countries with Oriental races, they're concerned about the eyelids. Here, it's the nose that we're a bit sensitive about. When people come to you to the center and ask about having a nose lift, or if it's someone with how do you call the eyelid na walang fold? Is there a technical term for it? Oriental eyes.
Oriental eye.
The Oriental eyes. There you go. So if somebody with Oriental eyes comes to you and say, I want the eyelid surgery, do you ask why they want to, they want their features modified?
We usually don't ask why. Nowadays, patients are more intelligent than 10 years ago because of the advent of the internet. They're able to search the information through the net. So when the patient come in, basically they know already.
They know what they want.
Yeah.
I see. So bihira na yung they come in and sort of like shop for a procedure. Parang, I don't know what I want, doc. How do you make me beautiful? Hindi na ganun.
Yeah, basically when they enter the clinic, they know what they want.
I see. And these days, a lot of Filipinos want the nose lift.
Yeah, for Filipinos, that's the most common cosmetic procedure.
What else? What do Filipinos want or expect from an aesthetic medicine clinic? What areas are they most concerned about when it comes to cosmetic enhancement?
Then in our clinic, the most popular is the laser hair removal, usually in females.
Oh, interesting.
Yeah.
Okay, laser hair removal.
Yeah, it refers to the temporary reduction of hair in the armpit, arms, or
And some nether
private
parts. and the naughty bits.
Yeah.
They want it clean and not just shaven, not just waxed, but laser treated.
Yeah, laser treatment.
Isn't that painful, Doc? Parang the laser will burn the hair away?
With females, I don't think it's a problem. With males, I agree because
Have you tried it, Doc?
yeah, I've tried it once in the chin area.
Chin area. That's thin skin. That's sensitive skin.
Yeah, it's like rubber band stinging.
Oh, wow. Pero kaya naman.
Yeah, kaya naman, especially for females
Sabi ko,
because
carry naman.
they're used to monthly pains, right?
There are a lot of females are used to a lot of torture.
Yeah, they have a high threshold for pain, unlike males
I know they have to give birth. They have a high threshold
for pain.
for pain. But laser hair removal is a step beyond waxing or threading, right? So it uses laser light to take away the hair, ganun ba yan?
Yeah. Usually in there are different laser treatment for hair. We have the diode, the IPL, and the Alexandrite and the Nd:YAG laser.
Mm-hmm.
But based on this four laser, the Nd:YAG or the Candela laser which we are using in Shinagawa is the gold standard in hair treatment.
So that
Laser
means it's
hair
the
removal.
most effective in
Yeah.
hair treatment?
Especially for Asian and African American.
Because is our hair different from Caucasians?
No, because the laser targets the hair follicle, and the wavelength of the laser is appropriate wavelength for Asian and African American.
Our OJTL has is entranced with what you're saying. Parang she's thinking right now, I have to go to Shinagawa tomorrow and ask about this laser hair removal.
So then we'll schedule here.
Yes,
tomorrow.
you'll schedule Elmer tomorrow. Heard on Thursdays on Manila's hottest monster radio, RX 93.1. Let's hear Lou say that. This is RX 93.1. I'm Rafi Reyes, together with Dr. Ely Tan, Medical Director of Shinagawa Lasik and Aesthetics. We're talking about the aesthetic side of Shinagawa tonight. Last week we had Dr. Jim Dinglasan talk about the LASIK procedures. Tonight it's all about aesthetics, how to beautify yourself through the most advanced cosmetic procedures available in Shinagawa and tried and tested in Japan with more than 1 million patients attesting to their effectivity and benefits. So with laser hair removal, is it something like I can just walk in? Not that I will, who knows? I can just walk in, and if your doctors are available, okay, now I can have it done right there and then.
It depends because there are criteria before doing the surgery. I mean the laser treatment.
Okay.
Like
I won't have a nervous breakdown after I lose my hair. Am I gonna?
not really. Usually we advise the patient to refrain from plucking or waxing the hair
Before?
4 weeks prior to the
4
treatment.
weeks
Yeah,
prior.
a month
I
prior.
see. Okay, so you want it fully grown before you start attacking it.
Not really. 24 to 48 hours before the procedure, we ask the patient to shave.
I see. The procedure.
Yeah. Because in laser treatment, we usually hit the hair follicle. So if we remove the hair follicle by plucking or waxing, then there's no target for the
I
laser.
see.
So
it has to have the target. So
yeah.
the follicles have to be there.
Because the laser is selective for that hair alone.
Mm-hmm.
Unlike the IPL, wherein it also treats the skin in the candela that we're using. It only targets the hair follicle, so that's why it's the gold standard for hair removal.
And being the gold standard, I suppose it takes a while before the hair comes back, if at all.
Sometimes it depends on patients, like the ethnicity, how the character of the hair, like if she's African American or curly hair, or there's a medical problem like yes, an ovarian cyst problem. It affects the outcome of the laser treatment.
I see. I guess it has to do with the hormones and all the
for
things that going
hormonal
on in your body.
Yeah. Sometimes stress can induce failure.
I see. But generally, how long does it take before the hair grows back? For most patients.
Like for some patients, after 4 sessions, that's 4 months, every month for 4 months, the usually 80 to 90% reduction in hair, and like after 6 to 8, the hair will not grow until 2 years. 2 years. Then if it grows, it's just a few, like 5 strands, and it's fine and small in numbers.
Sounds like a procedure that will be very attractive for those who need to the hair or to
for models or
actors and actresses, people in show business, and some people are on the go who just prefer to be hairless and can't spend time like every week shaving or having themselves waxed. Parang laki din investment in time
I agree.
and money, right? So a guy can have it done for facial hair if the guy doesn't want to shave every day. Pwede yun.
Yeah, it's possible.
And you have a high threshold. higher threshold for pain.
Yeah. Which
But,
we usually don't have.
which
but
guys are PUSS.
But in
IES.
such cases, we can apply like a topical anesthesia just to lessen the pain.
Mm.
We can do that in certain cases.
A double shot of whiskey is not recommended. No. Not good. Not good. I've gotten ahead of myself. What else are the services and products Filipinos can expect from Shinagawa?
Aside from the laser hair removal, we have also the fractional laser for rejuvenation, for like if for acne scars. In fractional laser, we usually target the pigmentation, the wrinkles, the scars, and it usually makes the skin younger.
Ano yung ginagamit ng doc? Laser din?
Yeah, laser
Laser
then.
din. Okay.
But the downside is there's a downtime with fractional laser. Like your face will be red for 3 days.
3 days.
Yeah.
Parang okay lang yun.
Yeah.
If your
Usually
acne problem is really bad.
Yeah. But with any other laser, usually the minimum requirement is around 4 sessions for each treatment.
So for scars, for acne problems, for those with rough skin, that can work.
Yeah, for acne scars,
Okay,
especially.
what is this procedure again?
Fractional laser.
Fractional laser. Okay, what else do you have?
We have
What are the popular
also a
procedures?
machine right now too for tattoo removal and pigmentation.
Oh, nice. So it's now possible to have your
Tattoo removed, yeah.
tattoo removed. The one you
Yeah.
got when you were a teenager that says "I love XXX" and
Yeah,
now hate XXX
Yeah, even the colored one we can remove.
without leaving a scar, like a pekla. Slide.
Sometimes we can. It's possible to have no scar, but sometimes, especially for scars done by professional tattoo artists, there is a possibility that scar formation, although minimal.
I just googled your website. It's so simple to remember. It's shinagawa.ph.
Yeah, Shinagawa.ph.
Okay, so that's SHINAGAWA.ph to go to the Philippine site for Shinagawa Lasik and Aesthetics. And you are located at the Enterprise Center.
Yeah.
Mezzanine tower to the Enterprise Center. That's the building. That's a beautiful building at the corner of Ayala Avenue and Paseo de Rojas in Makati. Where do you want to say your hotlines, Doc?
Our hotline is 491-000.
Okay, so 491 and 4 zeros. Very easy to remember. And what is this? We're talking about the procedures available at Shinagawa. So, what else do you have? What is this 3D thing?
Yeah. The 3D angel lift is one of the most popular procedure in our clinic right now. This was pioneered in Japan. So with this technique, it's a minimally invasive surgical option to facelift.
Minimally invasive facelift.
Yeah.
Surgical option. Pero surgery pa rin siya?
We don't consider it really as a surgery because we're just about 1 millimeter incision. So technically, it's not a surgery.
But it's a facelift.
Yeah, it's a
And
facelift.
where do you cut? Like, where in the face do you do that minimal incision?
We usually have a 2 or depending on the cases, we mark 2 areas in the tragal area. That's around in the lateral area of the eye.
Mm-hmm.
Then we insert a threaded suture.
Okay.
Then
So yung tahe nasa here sa side ng eye.
yeah, sa side.
Okay.
Then the thread is anchored at the temporal area. It's in the head.
Di ba masakit yun, Doc? Parang manipis yung
Of
skin.
course, there's anesthesia.
Okay. Siguro naman.
With anesthesia, there's no problem with the pain.
3D angel lip. Parang pictures dito. So, what is the advantage of that or disadvantage of that compared to your full facelift?
Of course, with the traditional facelift, which is a surgery, you have a downtime of around 2 weeks.
Mhm.
But with this one, just a few days, like three days.
That means practically instant results. Kung 3 days pa lang, nag-iba na yung mukha. I mean,
and
refresh na yung
and the
face.
swelling compared to surgery, it's nothing compared to the swelling of a surgery.
But the thing is with facelifts, not that I've had one, no, I haven't had one, is that, okay, nagpa-ano ka nga, nagpa-facelift ka, you wanna look more refreshed, your face, but people know you underwent the knife.
Because of the scar.
Because of the scar and because of the swelling, as you say. Yeah. So for some time, at least your close friends and relatives will know that you went to the doctor. Kasi makikita na, maybe you can avoid like the greater society, the party people you don't want to see for some time, and make an excuse that you went abroad or you went to the provinces, pero your friends will know. So 3 days ka lang magtatago.
Yes.
Kaya pala 3D yun, Doc, no?
3 days.
3 days lang. Bakit nga ba 3D? 3-dimension? Angel lift. Cute naman ang pangalan, Angel lift.
Usually with the traditional threaded lift, usually the thread is just on one layer.
Mm-hmm.
But with the 3D angel lift, it's 2 layer. So that's why it's 3D.
And who are candidates for this 3D angel lift?
Sometimes it depends on the lifestyle of the patient, but if we're talking about age, usually as early as 40, or maybe late 30s.
Have you had guys come to your clinic for
Yeah, we have.
You have?
Yeah.
Really? Like, from what professions? Who are interested in an angel lift among men?
Engineers.
Engineers?
Yeah,
Come on,
engineers.
really?
Yeah. And we have also
I will ask Engineer
from
June
other
Villa.
countries, like from Saudi. We have patients who come in just for the surgery.
They come over to the Philippines.
Yeah, just to have the 3D angel lift done.
So that's part of our medical tourism bit,
Yeah,
diba?
yeah.
Tie-in destination for that. You're at the forefront of that. I'm sure the procedures that they can get here in the Philippines at Shinagawa would cost them far less than it would in their countries.
It's like if you do it in the US, you're paying. Here, maybe if you compare the price, maybe you're just paying for the consultation.
I don't know.
Yeah.
Like kahit sa Japan, would you say that your rates will be cheaper here?
Yeah, it's cheap. Definitely cheaper here
than in the Shinagawas in Japan.
Like in the US, it costs around like $5,000 US. But here, it's around 700 or so.
What else do you have? You have a lot of procedures. I'm looking at the new lip injection. So who's interested in lip injection?
Patients who fuller lips, they are candidates for lip injection. We usually inject hyaluronic acid. It's a naturally occurring substance in the body, which after aging, the level of that HA is depleted, so you have to replace it with exogenous
and
source.
You want to have that Angelina Jolie out.
The Angelina Jolie lips.
Do patients come to you, Dr. Ely, and present the picture? I want to look like this. I want this nose. I want this lips. They do? I'm
Yeah,
sure
yeah,
they
they
do.
do.
With their magazines.
Yeah.
And I can see your reaction.
But
Your hi reaction. What do you tell them?
but sometimes it's difficult. Like
You can't look like Angelina Jolie.
yeah, especially the nose.
Especially the nose. Mahirap.
Yeah. Sometimes if you use the same implant but two different patient, it will come out different. So that's what I'm saying to patient that we can only improve the feature, but we cannot copy another nose and
You tell them that.
Yeah, I tell them that.
Because people often expect miracles from their doctors, especially when it comes to cosmetic treatment. They feel, I'm paying for this. I want to look like this movie star, this TV star. How do you help them manage their expectations? What do you tell them to reassure them at the same time? Easy ka lang. You're not going to look like like Angelina anytime soon or Brad Pitt.
Actually, that's a problem with the practice of cosmetic surgery. Like, patients are expecting miracles to happen. Like, for example, in scar, usually the perception of the layman is that after the surgery, the scar will be magically gone.
Mhm.
But I'm with all the patients that I have encountered, I just told them that the scar will be uh, the appearance will be better compared to the
To the what you took out.
but not totally disappear. The scar will not disappear.
You're honest with them.
Yeah,
Do patients ever come back to complain, to say, Doc, I expected something else?
there are cases, but with like reassurance and at the onset, you should reassure the patients or uh, the expectation should be within the limit of the surgical practice.
What you can offer, and you're clear with them regarding that. Right on Thursdays on Manila's Hottest Monster Radio RX 93.1, I'm Rafi Reyes, together with Dr. Eleazar Ely Tan. He is the medical director of Shinagawa Lasik and Aesthetics Center, located at the Enterprise Center. We're talking about, in a sense, we're talking about the state of cosmetic surgery here in the Philippines, because they do offer the latest advances in cosmetic surgery at Shinagawa, from procedures and techniques and equipment refined, if not originated in Japan. Now, I saw something about a laser something treatment in your website. Where is that? For laser carbon peeling. Is that? Oh, that's for whitening. That's not for scars.
This one is not yet available.
Oh,
here.
it's not yet available. Okay, coming soon. Coming soon. Let's walk the listeners through the process. Let's say I visit Shinagawa tomorrow, and I tell the doctors what I want done, because, like you said earlier in the show, people have very specific ideas about what they want done.
Yeah.
So I come in for a consultation, and what's the next step usually? I know what I want. I want to look like this. I want this nose. I want these lips.
Usually when the patient come in, we have a beauty consultant who will assist her or him regarding the procedure and the expectation. And with any other medical practice, usually the treatment starts with consultation.
Mm-hmm.
So with the consultation, of course, you have to extract a good history and physical examination. Then afterwards, with the patients assured of the problem, we can go now to the options of treatment. It will be either surgery, non-surgical, and or any other option based on the assessment.
For young listeners, say under 30, what are the more popular procedures that they ask about?
Under 30,
Under 30.
usually fractional laser,
Nose lift, I guess.
nose lift, eyeball surgery, breast augmentation,
Breast augmentation. Now we get to
liposuction.
that. Now we get to those sensitive but very juicy topics: liposuction and breast augmentation. All right, how big is big when it comes to breasts? Like, when a woman comes to you, Doc, I want my breasts enhanced. What is the negotiation here? Like, do you first ask them how big do you want? Do you really need bigger breasts? Why do women want bigger breasts? I don't, it sounds like a rhetorical question, pero kayo yung doktor, kayo yung kausap ng pasyente.
Usually, it's to uplift the self-esteem of the patient, and on occasion, because the husband wants it.
Because the husband wants it.
Yeah,
Medyo merong...
like stretch mark eraser and deodorant body scrub.
You also offer the regular skin dermatologic services, do you, in Shinagawa?
Yeah, we offer also the routine like dermatologic procedure, like we do Botox, filler injection, pathologic derma diseases or problems, acne surgery, skin peeling, shin treatment, facial. Is to have a healthy lifestyle, because with healthy lifestyle goes a healthy skin and healthy body. So avoid smoking if possible. Avoid the sun, because it especially during between the 10 and 3 p.m., which is the hottest time of the day.
Kind of rainy season, no?
For during this rainy season, we should take care of our skin, like after going out, we should make sure that we use a non-allergenic, hypoallergenic soap, because sometimes like fragrance can stimulate the allergic reaction in the body.
So healthy lifestyle, avoid the sun. What else, Doc, do you recommend?
Avoid smoking.
Avoid smoking.
Eat a balanced diet, fruits and vegetables. Of course, we should also like supplements with like vitamin A, C, E, which is a good antioxidant to prevent to increase our immune system and to prevent diseases like cancer of the skin. Okay, thank you, Rafael, for having Shinagawa.
Thank you very much, Dr. Ely Tan, for Shinagawa Lasik and Aesthetics. Remember, you are beautiful, whoever you are. But if you want to be more beautiful, then you can visit Shinagawa Lasik and Aesthetics. Next up is Dr. Love Tom Alvarez for the Late Night Clinic. This is Rafael Reyes. We're here on Thursdays. Join me again next week for a beautiful conversation with beautiful people. Good night. Thank you.